So what I'd love to do is dispel a lot of the myths around the treatment of ADHD and really help y'all understand how sort of clinicians approach, really in an evidence-based manner, what is the best way to treat ADHD. So as we've already mentioned, the majority of research on treatment and sort of just the research on ADHD tends to be within kids. Even if we look at, for example, the percentages of diagnosis, 5% of kids have ADHD, whereas only 2.5% of adults have ADHD. So a lot of the trials that we have, a lot of the studies that we have actually focus on the pediatric population. In adults is somewhat similar. So studies on adults show that basically medications and therapy work equally well. So it's not like one works better than another. Some of the appetite stuff and growth stuff is less important for adults. And so oftentimes adults will take medication earlier on. This too is because oftentimes that's because we're adults, right? So I may not have time for doing 2 hours of therapy and organizational planning and this and that on a given week. It's just easier for me to take a medication. So generally speaking, though, I still recommend therapy as a first-line treatment if you're an adult with ADHD. And then you can combine medication, you can add medication onto it if you need to. And studies also show that combining medication and therapy is more effective than doing either alone. But that's where more studies also kind of complicate the picture, because there are some studies that show that over an 8-week period, if I do therapy, I get this much. If I do medication, I get this much. And if I do both, I get this much. But then there are also studies that show that if you go a year out or 2 years out, that medication plus therapy is no more effective than just therapy. So this is where it seems like the effect of medication and the effect of therapy seem to kind of move towards each other. So the research is a little bit more complicated, but medication plus therapy doesn't outperform just therapy at 1 year out, 2 years out. But in the 4-week span, in the 8-week span, it seems to outperform it. And that kind of makes perfect sense to me, because if you think about what a lot of the therapy for ADHD is, and we'll go into more detail on this in a second, it's very similar to what we do for kids. So it's doing things like developing to-do lists, using calendars, becoming more organized, building habits, limiting distractions. And that stuff takes time, right? So the advantage of a medication is that it tends to work really, really fast. So if I take an amphetamine or Adderall, or I drink a cup of coffee, I instantly get some kind of improvement in focus. Whereas building a habit takes longer than 8 weeks. So as we tunnel down into the research, what we really see is that medication can be really effective and can help a lot. And what you also find with a lot of patients is they notice the difference immediately, right? Me being on Adderall or not being on Adderall is like night and day. The medication absolutely transforms my life. The unfortunate thing is that just because you're aware of the difference and it becomes very clear to you doesn't mean that you need to be on Adderall for 2 years. But what happens once you start using a stimulant medication is if you ever go off of it, you lose all of that effect, right? And so then people become really, really attached to their stimulant medication because it's really hard to go back to square one without it. At the end of the day, I tend to recommend therapy before medication when it comes to adults. And now we're going to dive into a little bit more about what kinds of therapy we use for adults and what kind of medications we use for adults. So I kind of divide the therapy for ADHD into 2 major buckets. So one is if you look at things like cognitive behavioral therapy for ADHD, it has specific protocols. And these protocols tend to be somewhat similar to what we're doing for kids. So it's literally teaching people organizational skills, how to reduce distractions, how to prioritize, how to manage some of their emotions, which can really interfere with ADHD. And this kind of skill set, what I really like about ADHD treatment is it's the one psychiatric disease that basically everyone can benefit from the treatment. So even someone who doesn't have ADHD can benefit from being more organized. Even someone who doesn't have ADHD can benefit from understanding their emotions better and reducing distractions in their life, especially in this day of overwhelming technological input. So that CBT kind of camp, or that CBT camp of therapy, is really about organizational skills, building routines, habits, etc. The other thing that I've sort of discovered in treating adults with ADHD is that oftentimes growing up as a child with ADHD comes with emotional or almost traumatic consequences. And so if you're thinking about, if you think about an adult and growing up as a kid with ADHD, you're not really able to pay attention in class. You get into trouble when you fight with kids on the playground. You don't really wait for your turn. And if you think a little bit about what that does to a kid, right? You start to avoid activities. There's nothing that you're really great at. Or maybe there's just one thing that you're great at. And for a lot of these adults, they weren't diagnosed with ADHD as kids. So they didn't really get the appropriate support that they needed. And so what that results in is a large amount of like shame, sort of like self-esteem issues, and almost like losing out on the joy of childhood because ADHD robbed you of it. And so that in and of itself requires some amount of therapy. And this is where we're not really focusing on how to deal with the ADHD now. We're not focusing on how you can be more successful at work or how you can build healthier relationships. We're really focusing on healing the damage from growing up as a child with ADHD. So that's kind of the second camp of therapy that oftentimes I'll engage in. That's a little bit more psychodynamic in nature, so it's more kind of like talking about your feelings and like crying with your therapist and like having cathartic breakthroughs and like that kind of stuff. And so that's sort of what we think about for therapy. In the medication camp, I'm going to sort of simplify this into two options, which is stimulant medication and non-stimulant medication. So stimulant medication includes things like methylphenidate or amphetamine salts. So these are things that in the US we'll call things like Ritalin or Adderall. And there are non-stimulant medications as well, things like bupropion or atomoxetine for adults as well. So there's some like different kinds of meds that are not stimulants. So the key thing to think about in terms of whether a stimulant is appropriate or not appropriate, or whether how they work. The first is that stimulants work real fast, and boy, can you tell a difference. And since you can immediately tell a difference, a lot of times patients really, really like them, right? So I take my Adderall in the morning and then like I can focus for the next 6 hours, like no problem whatsoever. I'm an absolute beast. I can get all my work done. So oftentimes people will get pretty attached to using stimulant medication. The downsides of stimulant medication are oftentimes there are side effects, so they can interfere with things like sleep, they can make people feel jittery, they can make people feel, because it is a stimulant, right? So we'll get into this more when we talk about the neuroscience of it, but the way that stimulant medications work is they essentially stimulate the inhibitory parts of our brain. So if we think about ADHD, my mind is getting distracted because it's overactive and it's thinking about this and thinking about this and thinking about this. So when we use stimulant medication, what it allows is that it strengthens the part of our brain that reins in the other parts of our brain. It almost strengthens the brakes in our brain as opposed to revving up the gas pedal. The problem is that even though it has that effect in the brain, it revs up the gas pedal in the rest of our body, right? So stimulant medications will increase our heart rate. They'll sometimes increase our blood pressure, can affect our appetite, can make it hard for us to sleep, can make us feel kind of jittery and restless. So when we take a medication, that gets distributed all through our body. And so sometimes we can see a lot of side effects with that. The other concern that we have is that stimulants are sometimes abused or even, unfortunately in a lot of cases, sold to people who will abuse them. When I was in residency in Boston, I think a 1-month supply of a stimulant medication like Adderall would go for anywhere between $1,000 and $2,000. So what people would do is like, get a month's prescription of Adderall and then like sell it for 1,500 grand on the street. Unfortunately, stimulant medication can be abused. So we want to be really, really careful with people who have a history of addiction. Oftentimes, there's also some research that shows that you can still prescribe it to people who have a history of addiction, addicted to other things like alcohol and opiates, ideally. But we have to be really careful about potential for abuse, potential for addiction, and even potential for things like diversion. For non-stimulant medication, that's when we'll sort of think a little bit about non-stimulant medication, although you can also use it first line. They tend to work comparably well. The things about non-stimulant medication is you're not going to have to deal with the abuse concerns. You're not going to have to deal with some of these side effect concerns and things like that. They'll have their own side effects, but they tend to be easier to tolerate. The main thing about non-stimulant medication for ADHD is that it takes time to work. So it's not going to be like popping a stimulant medication and instantly feeling the effect. Sometimes the non-stimulant medications for ADHD will take weeks to work. And this can be really confusing for patients if they miss that detail. So this is what happens when you go in and you talk to your psychiatrist about medication, right? They'll sit down with you for like 15 or 20 minutes, and they'll like shoot lots of information at you. They'll ask you like 10 questions in about 30 seconds, and then they'll say a little bit, and they'll be like, okay, here's the thing that you have to watch out about the medication. You got to watch out for this, you got to watch out for this, you got to watch out for this, you got to watch out for this. You understand? Oh, by the way, this, and this. And you're like, yeah, okay. And then they give you the medication. I'm sure it'll work great for you. Good luck. Come back in a month. And so we sometimes lose sight of the fact that non-stimulant medications can take weeks to work. And so sometimes what we'll see is that patients will try it for a couple of days. They may get a little bit of upset stomach or some kind of side effect, but it's not, their life hasn't been transformed. And here they are talking to their friends who got a stimulant medication, and they're like, on day one, I felt like a completely different person. And they're like, I want the good stuff, right? Screw this non-stimulant medication. And then they come back to the psychiatrist and like, this medication isn't working. And then they're like, please give me the stimulant, right? And then the psychiatrist says, no, give it a couple more weeks. And then the patient is like, screw you. And then they call someone else and they're like, hey, can I get stimulant medication? That happens, unfortunately, a lot. So stimulant medication can work really well. Non-stimulant medication can work really well. Just remember that stimulants work faster than non-stimulants. The other thing to remember just in general about treatment is that it's not binary in terms of working or not working, which is something that I see people are getting increasingly confused about, right? So if you look at like forums about ADHD or like discussions about ADHD or TikToks about ADHD, this is a 60-second bit of information or one comment where one person is like, man, I got diagnosed with ADHD and I got put on medication and it transformed my life, period, right? So you'll see like 3 sentences or a 60-second clip about how medication revolutionized their life. And so then what happens is it creates this idea that it's kind of binary. I get the diagnosis, I get the meds, and then my life should be transformed. But the truth is that ADHD treatment, just like all other psychiatric treatments, takes time and effort to figure out because medication doesn't affect every person the same way. Just think about this for a second, right? Does everyone like pizza the same way? Does everyone handle dairy the same way? Does everyone break out when they eat a particular kind of, cow's milk? And some people can handle goat's milk or sheep's milk. And some people do fine with tofu. Some people are allergic to soybeans. So the things that we put into our body affect us differently. ADHD is not the same in every single person. That's why the diagnostic criteria are so varied. And as we go into the neuroscience, we'll start to see how it's even more varied than the diagnostic criteria suggest. So any kind of treatment that you engage in, the most important thing to remember is that it's not that treatment works or doesn't work. It's that you keep trying until you figure out what's the right formula for you. And if we just look at what we've talked about today, we can see that, right? So if you go to a CBT therapist for your ADHD and you're working on organizational skills, prioritization, and habit building and reducing distractions, that may work for some of the stuff, but what about all the shame? What about like being 24 years old when you graduate from college and like, whereas your friends are graduated at the age of 21 because they're super smart? The organization, using a calendar doesn't fix that, right? So you may need a different kind of treatment. And the same is absolutely true for things like medication. People have different dosages. There are lots of different medications to try. So it's not like medication didn't work for me. It's what was the dose? When did you take it? This is another thing that's really important for ADHD medication especially. This is where people, when you take it is very important. So for something like, let's say, antidepressant medication or your arthritis medication, you may be able to take it at any time in the day. But when it comes to ADHD medication, there's short-acting medication and there's long-acting medication. So for some people, what they really like is they like the long-acting medication because they take 1 pill in the morning, they don't forget it in the morning, and then the medication lasts for about 6 to 8 hours, so you kind of get through the workday, and then you have no problems going to bed at night. For other people, what they really find is that the long-acting medication doesn't kind of give them enough in the morning or in the afternoon. So instead, what they'll do is take short-acting medication twice a day, once at 8 a.m. and once at 1 p.m. But then there's sort of also the medication wears out of their system by the time that they go home. For other people, they need a higher dose of long-acting medication. So there are a lot of different variables here that you can move around to try to figure out, okay, When do you really need your mind to focus? When do you need to get work done? When can you afford to be a little bit disorganized? Like, not that big of a deal. When I'm cooking, when I'm picking up groceries, okay, I have my grocery list, so I'm not going to forget that. But when I'm really at work and it's 10 a.m. and you've been sitting in meetings for 2 hours and you're going into your third meeting of the day and you're going to be listening to some guy talking for the next hour, like, you need that medication, right? You can't get up and walk around. You don't get to smell or cook, or the oven isn't going to beep. Like, it's torture unless you have your medication. So it's a very individualized approach, and don't give up just because something doesn't work. If something doesn't work, that's absolutely a conversation that you need to have with your doctor. Just to give you guys a sense, I will oftentimes work with people for 3 to 6 months to try to figure out, okay, what is the perfect medication regimen for you? What's the right amount of therapy? What's the right amount of organizational skills? Do you need help with a calendar, or is what we need to do like help you clear distractions from your phone or your technology usage? And so keep at it, right? Don't give up hope, and remember, it can be very, very customized. So sometimes people will go to see a psychiatrist or a therapist, and here we are talking about meditation and dietary changes and all these like organizational things you can do in therapy, and like processing the emotions of growing up as a kid with ADHD when no one ever let you play with them because you were always cutting in line. You kind of go see a doctor, right? We say, go see a therapist. You go see a doctor and they like talk to you for 5 minutes. They give you a checklist, you check some boxes, and they're like, here's a prescription. Adios. Right? So that, unfortunately, is a lot of the experience that people have. So one of the things that we tend to see is that as mental health is kind of developing, it's kind of developing in the wrong direction sometimes. And that sometimes, unfortunately, the best way to get paid as a mental health professional is to just prescribe medication. Because if I'm spending 15 minutes with a patient, I can see 4 patients an hour instead of 1 patient an hour who I spend time talking to, and that just makes me more money. And so it's unfortunate that is the truth of the situation sometimes. So if you are in that situation where you feel like someone is just jumping to medication, I would encourage you to share that with the person and say, hey, I recognize that you made a diagnosis and you're recommending medication, but I really want to understand what my options are. What are the alternatives? I'd love to have a conversation about what are the different treatment approaches for ADHD, because I'm not really ready to start medication yet. And that's where you'll see how the provider responds. And they may say, well, it's like take it or leave it. Like, this is what I recommend. It's what works for the most patients that I've seen. And if you really want to, you can also like kind of push back on that a little bit more. And you're like, well, it sounds like that's all you do, But I wouldn't say that. What I'd also ask for is if at the end of the day you're not happy with your psychiatrist, what I would do is ask for a referral. Do you have recommendations for psychiatrists who are willing to consider other non-pharmacologic things, or will incorporate pharmacology into a more comprehensive treatment plan? And I really, really encourage you to use that sentence, because that sentence highlights to the psychiatrist how bad of a psychiatrist they are, because it helps them realize that there isn't a comprehensive treatment plan. They're just reaching for a medication. So by all means, ask for something or ask questions if you're not happy with medication, right? Say, hey, I'm interested in non-pharmacologic alternatives or incorporating medicine into a broader, more comprehensive treatment plan. And you can just ask, are there other people out there that that do that kind of thing more than you do? And I think it's very, very important that if you're unhappy with your mental health provider, remember that they're there to serve you, right? Like, they may have a lot of power in the relationship for sure, but at the end of the day, a doctor is not the boss. A doctor is someone who's there to serve the patient. And if you feel like your needs are not being met, by all means, vocalize that. Vocalize that in a respectful way, and then try to find someone else who's more aligned with what you're looking for. It doesn't necessarily mean that the doctor has to change and adapt exactly to what you do. They may be doing what they're doing for a good reason, and that just may be their experience. But it's totally fine to shop around until you find someone who's more aligned with your treatment goals. The last thing that we're going to talk about is something that people are very, very interested in nowadays, and especially with ADHD, which is complementary and alternative medicine. Before I did this whole healthy gamer business, I was actually focused on integrating evidence-based complementary and alternative medicine into psychiatric practice. That's where I really developed my interest in things like meditation, and interest in things like Ayurveda and stuff like that. Unfortunately, ADHD is one of the diagnoses where there's the least evidence for good CAM interventions. So aside from meditation, which has overwhelming evidence that it's very, very effective, everything else is kind of like doesn't really work great, okay? So let's talk about meditation first. So the cool thing about meditation, we'll go into this in more detail when we dig into neuroscience, is that meditation works directly on many parts of the brain that have deficits in ADHD. So meditation boosts our frontal lobes, it boosts our emotional regulation, it boosts our ability to focus, it keeps us from getting distracted, it does all kinds of things. So meditation is actually really, really good for ADHD. We'll even go into specific meditations that are designed for people with ADHD. The next things that we're going to talk about are essentially a lot of people have done studies on diet. And so people are curious, if I change my diet, can I sort of adjust my ADHD? So there are a couple of early studies, for example, that showed that, so there's one study, I'll just give you all an example, that showed that fish oil supplementation or omega-3 supplementation seemed to have a positive impact at reducing ADHD symptoms. And so people got really, really excited and they were like, oh, like I don't need to take medication. I don't even need to meditate. All I need to do is like take a fish oil supplement. Fantastic, it'll cure my ADHD. And so when more people did it, what we sort of found is that like people weren't benefiting so much from it. And then researchers dug down even further and dug down even further. And what they actually discovered is that there are different genes in ADHD. And so depending on which gene allele you have, some people have a certain kind of like deficient allele where if you supplement omega-3, they get a big boost in terms of ADHD symptom reduction. But if you're in the 2/3 of the population that doesn't have that allele, that omega-3 supplementation doesn't help you at all. So this is the kind of thing where if you really look at it, does omega-3 work? Well, it seems to like help in about 1/3 of people. That also is a Caucasian population, if memory serves. So that, alleles tend to be different across ethnicities as well. And so people have looked at other things. So people have found kind of signals of dietary changes helping. So another thing that got a lot of interest is actually like additives, preservatives, and artificial colors. So there are some studies in children that showed that like sort of removing preservatives and artificial coloring from the diet seemed to improve ADHD symptoms. And so people kind of tunneled that down into that further and really found that the effect, once you apply to a large population, seemed to get smaller and smaller and smaller. And so once again, that's sort of a situation where it appears that some kids are sensitive to that kind of thing. And something about the way that they digest food, something about the way that their metabolism is, makes their ADHD worse if you sort of have artificial foods and preservatives. Another thing that people have talked a lot about is carbohydrate to protein ratios. So this is something that I think is more generally helpful, but if you sort of eat less junk, like simple carbohydrates and sugar, and have a higher protein diet, that appears to help symptoms of ADHD. And we're not quite sure how that works, but one of the things that we're sort of learning in medicine is that eating trash tends to make stuff worse. Like, I don't know how else to put it, right? And so you can go into detailed science, and we may do that at some point, but at the end of the day, like, if you eat like crap, like your obesity is going to get worse, your arthritis is going to get worse, your depression is going to get worse, your ADHD is going to get worse. And if you eat healthier, like if you eat fiber and stuff, like that's going to help. I'm sure there's more complicated stuff to it. I'm sure there's more detail to it. But the studies really don't show that there's a huge transformative impact. But people keep on kind of looking into this stuff. And the key thing to remember about dietary interventions, because that's where most of the kind of CAM or alternative medicine studies are going, the key thing about dietary changes is that the one conclusion we can make is that, aside from just generally eating better, a lot of this stuff seems to be very individual. So when parents come to me and they'll say like, oh, I've heard that my kid has ADHD and I was listening to a podcast, the Happy Moms and Happy Kids podcast. And in the Happy Moms, Happy Kids podcast, there was a happy mom who was talking about how much happier their kid was once we removed artificial coloring from their diet. So unfortunately, they never get to go to birthday parties anymore because cupcakes always have artificial coloring. So I just don't let him go to birthdays, but he's a happy kid now. So people will sort of come in with this stuff and they'll be like, what do you think about this, doctor? And what I'll sort of say is like, by all means, try it out. But the data suggests, as we sort of do more and more studies, it seems like there's an individual variance in terms of the response to dietary changes in ADHD. So you're going to have to kind of experiment on your own, and we'll do our best to guide you a little bit there. But unfortunately, there isn't like a really powerful dietary intervention that you can make that appears to really profoundly impact ADHD. In terms of herbal supplements and other kinds of things, there really isn't great data on that stuff. I know that nowadays everyone's talking about nootropics and cognitive enhancers, taking things like ashwagandha and this kind of stuff to like improve mood and focus, and green tea extract and stuff like that. I mean, a lot of that stuff is just like straight caffeine. And if you look at like supplements that are cognitive enhancers, just see if they put caffeine in it, because that can account for a lot of it. And then there's not really great data about the rest of it. I mean, there's some studies that show that some of this stuff kind of works, but when applied to larger populations, when sort of, taken outside of like a very small isolated clinical trial, we just don't really know yet. So at the end of the day, treatment for ADHD is actually more varied than people realize. There are a lot of things that people kind of get wrong about it. The first is that it doesn't have to happen right away, right? It doesn't have to work right away. That medications can be a part of it or not a part of it. That you can learn organizational skills as an adult, and you can sort of process the trauma of growing up with ADHD, and that seems to really make people happier and like better at doing stuff. A lot of the research that we have is focused on kids, because ADHD for historically has been a pediatric diagnosis. And we even see that reflected in the amount of children who are diagnosed with ADHD versus the amount of adults who are diagnosed with ADHD. Unfortunately, the rate of ADHD is increasing across the board, and I think the adults are catching up. So the most important thing to remember about treatment for ADHD is that if it doesn't work, don't lose heart. There are a ton of modifications that you can make, right? And the reason that we're sharing with you that there are organizational therapies, there are kind of emotional therapies, there are stimulant medications, there are non-stimulant medications. You can adjust the dosage of your medications, you can adjust the time of administration of medications. There are lots of different things that you can do. And even if you don't want to do any of that, you can also do meditation. There are lots of different meditations. There are even dietary changes you could make. You could cut out, the villain of the modern day, which is gluten, and maybe that'll make a difference. The truth is, we don't really know until we try it. So don't lose hope just because you've tried something for ADHD and it didn't really seem to work. The goal of this particular lecture in this module is to help you understand there are a lot of different options out there. And if this kind of stuff appeals to you, by all means, go see a licensed clinician, because they're the people that are going to be trained to help you develop a tailored plan that will work for you.